Preoperative nursing care, let's go on our first concept. It's under your legal aspect, which is your informed consent. So we must obtain an OR consent or an OR permit bago natin isalang yung patient to undergo a surgery. Now, there are guidelines that we have to follow in obtaining our informed consent. First is that the surgeon is responsible for obtaining the consent for surgery. Second is that no sedation should be administered to the client before he signs the consent. And third, minors may need a parent or a legal guardian to sign the consent form. When we say minors, they are your 18 years old and below, unless it is an emancipated minor. When we say emancipated minors, they are the minors that are working on their own, so they are allowed already to sign the consent. Number 4, we have your elderlies may need a legal guardian to sign the consent form. 60 years old and above na patient will need also a legal guardian. Number 5, the nurse may witness the signing, but the nurse must be sure that the client has understood the surgeon's explanation of surgery. So, ano yung mga dapat i-make sure nung nurse before witnessing the signing of your consent? That there is no coercional force. So, hindi pinilit yung pasyente nung doktor para lang pumirma nung consent at para mag-undergo ng surgery. That the patient in a sound mind, ibig sabihin, walang sedation na nangyari, hindi siya na naka-under the influence of your alcohol, and also, hindi din siya mentally ill. Third na dapat mong i-check before signing as a witness is that the operation is understood of both parties. Kailangan naintindihan ng pasyente yung mangyayari, the pros and the cons, plus the complications, and that the doctor also must understand the position of the patient. Now, number 6, under your guidelines is that the nurse needs to document the witnessing of the signing. Kailangan nakasulat sa nurse's notes mo that you have witnessed the signing of your informed consent. Now, let's say, what if the patient is unconscious and need an emergency surgery pero walang magsasign na legal guardian? These are your possible order who can sign your informed consent. First, if there is a chaplain or a priest. Second is the highest ranking official on the organizational chart of your institution. And the last will be your physician. Sila lang ang pwedeng pumirma if emergency cases and we cannot hold to the legal guardian of the patient. Now let's go to the assessment of your health factors. Now, the overall goal of during the preoperative is that to prepare the patient for a successful surgery. Let's go to your physiologic assessment. Under your physiologic assessment is your age. So, if the patient is very young, so possible na yung kidney function niya is not yet fully developed. While for those very old or for our geriatric patient, there is already an impaired circulation, maybe because of arteriosclerosis, and there is also a limited cardiac function, and they are more sensitive already to morphine and barbiturates. In terms naman sa nutritional, obesity and malnutrition now will increase the risk of your surgical problems. For your fluid and electrolyte balance naman, dehydration, hypovolemia may predispose the patient to problems during your surgery. While your general health If there is a presence of systemic infection, such as your upper respiratory infection, it may decreases the lung compliance during your mechanical ventilation. Let's say naman your patient is under medication. If the medication is an anticoagulant, this may put your patient at risk for bleeding during the surgery. Or if the patient is taking tranquilizer, they may be at risk for your hypotension. Or heroin addict yung patient, then baka magkaroon tayo ng CNS depression or even coma. And if your patient is taking diuretics, there is a risk for your electrolyte imbalance. Now, the other part of your assessment for your physiologic is that you check also for the presence of pain. It may magnify or it will give you the extent of the disease. And then for your cardiovascular function and pulmonary function, isa ito sa mga chine-check before the patient has to undergo operation. Kasi they have to make sure that your cardiovascular and your pulmonary function is at its optimum level. For the renal function, they are checking for the excretion ability of your kidneys to excrete your anesthetic substance or agents in the urine. While for the GI function, your patient will be put in NPO most probably. So they are also checking for potential aspiration pneumonia. May mga doctors, they check also for the liver function. This is in conjunction with your kidney, and also your liver is responsible in clotting purposes. For your endocrine function, when they check for your endocrine function, it is to check for the proper metabolism and organ functioning. When we assess for the neurologic function naman, it has to be the motor and the sensory plus the rate of consciousness of your patient. When we assess for the hematologic function, i-check mo yung clotting time, the RBC, WBC, bleeding time, and the blood type of your patient. And then presence of trauma, you assess in a particular area. Second assessment of health factors is your psychological assessment. Surgery is a powerful stressor, so the person may make use of a different defense mechanism to deal with their anxiety. So you assess for the anxiety level and the effect of this anxiety to your patient. And a extreme anxiety may lead the patient to poor compliance, and if your patient bumagsak siya sa assessment of your mental health and attitude, you may refer your patient and the patient may need a professional counseling. So for our psychosocial aspect, dapat hindi din natin ito medyo din na downplay kasi it has a major effect perioperatively. So your psychological distress now has a direct influence with the body functioning. Therefore, it is imperative for the nurse to identify any anxiety the patient is experiencing. Once kasi sinabi sa patient na mag-undergo siya ng operation or magkakaroon siya ng surgical procedure, magkakaroon talaga siya ng emotional reaction. Pwedeng obvious ang kanyang emotional reaction or pwedeng itatago niya sa'yo yung tunay na nararamdaman niya. And then nagkakaroon din ng normal, yung expected na normal na reaction ng patient, na manggaling sa patient. Meron ding mga abnormal. Meron yung mga nag-hysterical, meron nag-hyperventilate just because they are informed to undergo your surgical operation. Well, this is an anticipatory response naman from a patient because pag sinabi kasi na magkakaroon ng surgical operation or ng procedure yung patient, pwede na magkaroon ng change or magkaroon ng threat sa kanyang role sa life, pwede din sa kanyang mismong buhay, or pwedeng nagkakaroon din ng threat sa kanyang body integrity. Mostly, na fears or concerns ng mga patient natin is the loss of work time. Tinatanong lagi nila yon kung hanggang kailan sila hindi pwedeng mag-work, ilang days sila naka-stay sa hospital, and then the loss of job, baka kasi hindi pa sila permanent or hindi pa sila regular. So, baka mawala yung trabaho nila just because they will be gone for too long. Tapos, magkakaroon din ng increased responsibilities or burden on family members kasi hindi naman basta-basta pag mag-undergo ng operation ang isang patient. So, yung gagastusin at saka yung magbabantay, yun yung mga iniisip nila. Plus, yung threat of permanent incapacity. So, baka kasi for amputation yung patient mo. So, yun yung medyo mga nagkakaroon ng emotional strain with the patient. Tapos, yung mga less obvious concerns naman may occur because of their previous experiences. Baka hindi kasi naging maganda yung experience nila with the healthcare system or merong sinabi yung mga patient, yung mga kakilala nila na nag-undergo na rin sa ganoong procedure. Now, our people tend to express their fears in different ways. Pwede na isang pasyente natin laging nagtatanong, although nasagot mo na yon, tanong pa rin siya ng tanong. Meron din namang ibang patient natin, magwi-withdraw sa'yo, and they will deliberately avoid communications. Pwedeng ginagawa nila, nanonood na lang sila ng TV, or they are on their phones, or nagbabasa na lang sila. Still, there are some also that they talk about trivialities. So, consequently, the nurse must be empathetic and they should listen well and provide information that would help and alleviate the concerns. Now, our important outcome for the psychosocial aspect is that to determine the extent and the role of the patient support network. Isa ito sa mga mag-build ng strong psychosocial aspect of the patient. And then, the value and reliability of all available support systems are assessed. Other information such as your usual level of functioning and typical daily activities may also assess the patient's care and rehabilitation plan. So, you assess also the patient's readiness to learn and determine the best approach to maximize the comprehension will provide the basis for your preoperative patient education. Huwag din natin kakalimutan yung spiritual and cultural beliefs. This will play an important role in how people cope with the fear and anxiety. Regardless of the patient's religious affiliation, spiritual beliefs can be therapeutic as a medication. So every attempt must be made to help the patient obtain the spiritual help that he or she requests. And faith has a great sustaining power. Thus, the belief of each patient should be respected and supported. For our preoperative nursing intervention, isa dito is your preoperative teaching. Now, your nurses have long recognized the value of your preoperative instruction, and each patient is taught as an individual with consideration for any unique concerns or needs. The programs of instruction should be based on the individual's learning needs. Multiple teaching strategies should be used. Example here is your verbal, written, return demonstration. This is not limited sa eto lang, example lang siya. It would all depend on your patient's needs and abilities. Now, your preoperative teaching is to be started as soon as possible. Pwedeng mag-start ka na after nung doctor sinabi sa patient na mag-undergo siya ng operation or surgical procedure until the patient arrives to your operating room. Now, when you are teaching, make sure that there is a appropriate space or pacing nung inyong instruction to allow the patient now to ask questions na maisip niya or that may arise, or and also to assimilate information. Now, frequently, teaching sessions are combined with your various preparation procedure to allow for an easy and timely flow of information. Ano nga ba ang included sa ating preoperative teaching? Isa dito is your deep breathing, coughing, and incentive spirometers. Isa kasi sa goal natin for the preoperative nursing care is to teach the patient how to promote optimal lung expansion and consequent blood oxygenation after anesthesia. Now, in case na meron siyang thoracic or abdominal incision, as a nurse, you have to demonstrate now your splinting technique while doing your deep breathing, coughing, and incentive parameters. This will now minimize your pressure and control pain. Second is your mobility and active body movement. The goal here in promoting mobility post-operative is to improve your circulation, prevent venous stasis, and also to promote your optimal respiratory functions. If there is any special position that the individual will need to maintain after surgery, example here is your adduction or elevation of the extremity, it is also has to be discussed preoperatively, as it is the importance of maintaining as much mobility as possible despite your restriction. So, pwede na doon, pwedeng exercise of your extremities that would include your extension and flexion. Now, let's go to your pain management. That is why it is very imperative for nurses to assess for pain. Either it can be either acute or chronic pain, so that the patient now may differentiate now post-operative pain from your chronic conditions. At this point also, you have to introduce the pain scale that you will be using and also explain how it is used to the patient. Post-operatively, there are medications na ma-administer to patient to relieve the pain and maintain your comfort without increasing the risk for inadequate air exchange. Meron din tayong tinatawag na PCA or the patient-controlled analgesia. It is the patient now who controls and delivers pain medication once nakaramdam siya ng pain. Let's go to our cognitive coping strategies. These strategies will be useful to relieve tensions, overcome anxiety, i-decrease ang fear, and of course, to achieve relaxations. Ano yung mga strategies or examples ng cognitive coping strategies? We have our first is your imagery. Now, the patient will concentrate on a pleasant experience or a restful scene. Second is your distraction. The patient will think of an enjoyable story or recites a favorite poem or a song. And then our third is the optimistic self-recitation. Now, the patient recites optimistic thoughts. Example here is your I know all will go well, mga ganon. Now, for the instructions for ambulatory surgical patient, the major difference lang is that for the outpatient preoperative education is your teaching environment. So, yung content niya, it may be presented in a group meeting, on a videotape, during night classes, at pre-admission testing, or by telephone in conjunction with the preoperative interview. In addition, answering of questions and describing what to expect, the nurse tells the patient when and where to report, what to bring, baka kailangan niya ng insurance card, list of medication and allergies, ano yung dapat iwanan niya sa bahay, yung jewelries, watches, medication, contact lens, and ano yung mga pwede niyang isuot, loose fitting, comfortable clothes, flat shoes. Now, the nurse in the surgeon's office may initiate teaching before the perioperative telephone contact. Now, the last operative phone call is designed to remind the patient not to eat or drink as directed. Pwedeng mag-fast na yung patient of 8 hours or more, depende sa ni-recommend, or for a meal that includes fried or fatty foods or meat. Let's proceed to your general preoperative nursing intervention. First, here is your managing your nutrition and fluids. So the major purpose now of your withholding the food and the fluid before surgery is to prevent your aspiration. But then the American Society of Anesthesiologists have reviewed this practice and have resulted in a new recommendation for person undergoing elective surgery who are otherwise healthy. So sino lang ang nire-recommend nila na mag-undergo ng lengthy or nung mahabang NPO status is that those persons who have compromised airway or coexisting diseases or disorders that affect your gastric emptying or fluid volume. Example here are your pregnant, obese, diabetic patient, patient with gastroesophageal reflux, enteral tube feeding, ill use, or bowel obstruction. They are still to have your lengthy restriction of fluid and food. Pero pag hindi wala ka dito sa mga to, then you are now recommended not to have a lengthy fluid and food restriction. Now the recommendation will depend also on the age of the patient and the type of the food eaten. Let's say adults are advised to fast for 8 hours after eating fatty foods or 4 hours after ingesting milk products. Most patients are currently allowed clear liquids up to 2 hours before an elective procedure. Pero, always check pa rin the doctor's order if the doctor would require the patient to still undergo an NPO status. Second is to prepare the bowel for surgery. Enemas are most commonly ordered preoperatively unless the patient is undergoing your abdominal or pelvic surgery. Now, a cleansing enema or a laxative may be prescribed the evening before your surgery and may be repeated in the morning of your surgery. Now, the goal of this preparation is to allow a satisfactory visualization of the surgical site and also to prevent trauma to the intestine or contamination of the peritoneum by your feces. Unless a condition of the patient presents some contraindication. Now, the toilet or the bedside commode is to be used when you are evacuating the enema instead of a bedpan. If the patient is hospitalized during this time, pag ikaw ang mag-e-enema na nurse sa patient, use the toilet or the bedside commode, wag yung bedpan. Then, additionally, pwede din na magkaroon ng request ang doctor for a antibiotic as a loading dose. This is prescribed to reduce your intestinal flora. And then last, we have your preparing the skin. The goal here is now to decrease your bacteria without injuring the skin. If the surgery is not performed as an emergency, the patient may be instructed to use a soap containing a detergent germicide to cleanse the skin area for several days before surgery to reduce the number of skin organisms. This preparation may be carried out at home. Generally, your hair is not removed preoperatively unless the hair is or at around the incision site. So, if it is around your incision site, it is likely to interfere with the operation. If your hair is to be removed, an electric clippers are used for safe hair removal immediately before the operation. We don't shave usually. They don't require shaving kasi baka magkaroon ng skin break. So, isa sa mga role natin as a nurse is to check for a pre-op medication. Meron kasing ibang mga patient, gusto nila, bago sila pumunta sa operating room, medyo na-decrease na yung anxiety nila or medyo antok-antok na sila or tulog na sila para hindi sila ma-stressed or maging anxious when they see the operating room. Now, the purposes of your pre-op medication is to allay anxiety, to decrease your pharyngeal secretions, reduce the side effect of your anesthesia, and to create a temporary amnesia. So, ano yung mga common na pre-op medication na ginagamit? For your tranquilizer, they are used to decrease your anxiety. Example of here is your Valium, Midazolam, and your Ativan or your Lorazepam. While your sedatives, they decreases your anxiety and produces an antiemetic effect. Example of here is your Phenergan, Psychosocial, and Stilnox. While for the analgesics, they relieve your pain, they decreases your anxiety, and also they also sedate. So example of here is your Tramadol, morphine sulfate, Demerol, Nubain. So, for the anticholinergics naman, they control or decreases your secretions. Example of here is your atropine sulfate. While for your histamine 2 or your H2 receptor antagonists, they inhibits your gastric secretion. Example here is your Tagamet and your Cimetidine. Common preoperative checklist contents. Ito yung mga i-check mo prior or kung naka-scheduled ang patient for e-surgery, ito dapat ang mga kompleto. Una dito is the OR consent and treatment signed. Either the patient or yung legal guardian or yung significant others ang nakapirma. Pero pag ang patient mo is for tabiso, make sure na yung patient plus yung husband naka-sign for that operation. And then, magkaiba po ang OR consent sa consent for admission. So, pag for OR yung patient mo, dapat dalawa yung pipirmahan niya. Consent for the procedure and also consent for anesthesia. Now, make sure also that the history has been completed. Ang sinasabi natin ditong history is your nursing history. Ano yung mga naka-under dito sa nursing history? The physical general appearance, skin, color, weight, hydration, and the energy level of your patient. Check also for the general physical health, mental attitude ng patient mo, ano yung kanyang stress and anxiety level. Understanding of the surgical procedure. Was the procedure clearly explained by the surgeon? And then, previous experience, nag-undergo na ba yung patient mo ng dati ng procedure, nasa-date na ba siya dati, nag-undergo ng anesthesia for a certain operation, expected outcome ng patient after the surgery or the procedure. And then, is the patient taking in medication such as your insulin or your anticonvulsants? Because this might affect or will put your patient on high risk for complications. Is the patient a smoker? Kasi your general anesthesia now irritates the respiratory system further. Is the patient a heavy drinker or occasionally drinks alcohol? Kasi for patients who has a high tolerance of alcohol, they are also have a high tolerance to anesthesia. And then the coping resources, malakas ba ang kanyang family support? What does the patient do to allay the anxiety and to decrease the stress level? And then self-concept, meron ba siyang poor concept? Because this might heighten the fear. While for the body image, these figurements may occur. Now, let's go to your third checklist contents. We have your consultation when necessary. If the patient has diabetes mellitus or has a cardiac case, so i-refer muna siya ng surgeon for either cardio clearance, pulmonary clearance, depende kung ano yung medyo doubtful yung surgeon na system ng patient. And then, number 4, you check for the ID band on wrist. This will serve as a identification kasi of the patient. And then allergy signs, if any, on file cover. So, yung nasa file cover mo or chart cover, meron kang minsan makikita na red strip tapos nakalagay na in capital letters yung allergy nung patient. Bakit sa file cover nilalagay? Para makita agad nung mga doctor at saka ng OR team. And then you prepare the operative area or have the patient pre-op, take pre-op bath shower. So, maligo muna yung patient bago pumasok sa OR room. And then, you also have to prepare the area kung saan magkakaroon ng incision. And then, pre-op teaching given. Your pre-op teaching content will be discussed further. And then your pre-sedation or tranquilizers or the pre-op medication. Plus NPO fasting posted dapat yun. So, saan nakikita yung NPO na yun? Sa kanyang, sa room kasi ng patient na mag-undergo ng surgery, may malaking whiteboard doon at nakalagay yung on NPO, nothing per orem, no food, no drinks allowed. Tapos kung kailan nag-start at kailan mag-i-stop. So, make sure lang na na-maintain yun. During or on the morning of the surgery, you check also on the following before sending the patient to OR. The lab results in file. Lahat ng ni-request ng doctor for the na lab results dapat nandoon na. And then old files or charts available. Minsan kasi the surgeon need it for comparison. And then dentures, jewelries, contact lens, prosthetics are removed and secured. Now the patient has to void already. And then patient in hospital gown only. No inner wears, please. And then vital signs 1 hour before operation. Bakit 1 hour bago ng operation at hindi yung at the time na mag-will in na siya sa OR or sa operating room theater? It's because if there is an abnormalities, pwede pang gawan ng paraan. And then pre-op meds given, your blood reservation if required. May mga doctors nagpapa-standby for a blood product, so make sure na meron na yung blood. And then spiritual needs met plus your nurse's note must be already completed.